Good afternoon, everyone. My name is Dr. Saima Hussain, and I'm a pediatrician at Longstreet Clinic. We would like to thank you for tuning in to our Facebook Live session today. For those of you not familiar with Longstreet Clinic, we are a primary care and multi-specialty clinic. We have 10 locations throughout North Georgia and more than 200 providers. We represent 20 medical specialties, including pediatric offices in Gainesville, Beaufort, Braselton, Oakwood, and Baldwin. Since the start of the pandemic, we have been working closely with many community partners, including Northeast Georgia Health Systems, Northeast Georgia Physicians Group, and the Department of Public Health. And we have been working closely with the school systems to disseminate very important health information related to COVID-19. We are back again today in hopes that we can provide helpful information to families about the COVID vaccine for the kids age 5 to 11. As you probably already know, the CDC and FDA have authorized the Pfizer COVID vaccine for children age 5 to 11, and children in our community are starting to receive their vaccines. We recognize that as parents, you have many questions. That is why we have assembled a great panel of experts from our Community Vaccine Coalition today to address and answer some of the most common questions that we hear from parents, so that you can make an informed decision for your family. I'm here today with Dr. Megan Farley, fellow Longstreet Clinic Pediatrician, Dr. Katie Herzog, another fellow Longstreet Pediatrician, Dr. Supriya Manapalli, Northeast Georgia Health System and Northeast Georgia Physician Group Medical Director for Infectious Disease, and finally, Dr. Zachary Taylor from the Georgia Department of Public Health District 2 Medical Director. We have a lot of questions to cover, and I'm going to direct each of these questions to one person, but I want this to be a conversation, so I encourage each of you to jump in and add anything from your perspective. We will also be monitoring questions from our viewers in the chat, and if we have time, we will like to address a few of these questions at the end. We have a lot of ground to cover in our brief time together, so let's get started. I would like to start with Dr. Taylor. Dr. Taylor, the Pfizer COVID-19 vaccine was officially approved by the CDC and FDA for children 5 to 11. It is a lower dose than the adult dose. Can you walk us through the timeline and quality standards for the authorization of this process for children?
Sure, and I think some people say, well, why is it taking so long for this vaccine to be approved for children? And I think there are two important factors. The first is that from the beginning, we've known that the severity of illness, the risk of death and hospitalization is much higher for our elderly population and our more medically vulnerable adults. So the focus of the initial development and approval of the vaccine was getting that population vaccinated so that we could protect them from severe illness. The second thing to remember is that, as I'm sure my pediatrician colleagues will remind me, children are not small adults. They're not just smaller, but they have a different physiology than adults, and they metabolize things differently than adults do. So a lot of time was spent getting the right dosage for the vaccine and then doing the appropriate clinical trials so that we could determine what whether or not the vaccine was safe and effective. And I want to reassure everyone that all of the steps that are taken to ensure vaccine efficacy, effectiveness, and safety were taken in the trials that looked at this vaccine in children. So it is a safe vaccine for children. It is an effective vaccine for children.
Thank you for that, Dr. Taylor. One of the things that we hear a lot is that this process was rushed. What would you say to parents that feel like this vaccine came out so fast?
Well, certainly if you look at the development of vaccines, it was faster than other vaccines. But there are several factors that account for that. And one of the big ones was that the government, usually when a vaccine is developed, a pharmaceutical company, they take the risk. So they put in the money, they do the trials, they see whether or not it's effective or not. and then they market the vaccine. Well, in this case, the government ensured them that they would have this market after the vaccine was developed and paid them to do all of that work up front so that they didn't have to take the same type of risk. So they were able to develop it much faster. The technology for this vaccine was already being investigated. So at the end of the day, this vaccine was not rushed. The speed at which we developed it was remarkable, but it went through every step that every vaccine goes through before it's given to children.
Thank you for that, Dr. Taylor. It's a very important point. And I'd like to continue on that with Dr. Manapalli. Dr. Manapalli, like Dr. Taylor mentioned, that this technology, specifically the mRNA technology, has been undergoing development and testing for years prior to the emergence of this pandemic. Can you talk to us about the science behind the vaccine, the pediatric dosage for kids, and how long it takes to become fully vaccinated?
Thank you. Thank you for including me on this forum today. So the technology is not new. It's been around for decades. Even if you look back in the research papers, you see papers published from 1970s and 80s about the mRNA technology. But I think it took them decades to know how to stabilize it, because the mRNA, the genetic material, is so fragile, so that we can actually use it in the vaccines. This is the same, as Dr. Taylor said, it's the same technology that was investigated while developing vaccines for Zika or Ebola. So, and also the advantage with this is also it can be mass produced quickly, which is what was needed with the pandemic. So I think the technology came to use very timely for us. And when it comes to the doses, going back to what Dr. Taylor said, really the FDA, the CDC, the researchers took their time when it comes to authorizing vaccines in the children. The vaccines were authorized first in the adults, which is the 30 micrograms dose. So we learned a lot from the studies in the adults, then the adolescents, then the next age group is the 5 to 11-year-olds. So they, when they looked at the children, as Dr. Taylor said, they're not just small adults. Their immune systems work differently. So they actually looked at different doses. They looked at the 30 micrograms, the 20 micrograms, the 10 micrograms, and with a small sample size, very small sample size. And then once they made sure that the 10 micrograms is safe, but also it elicited the adequate immune response to protect them, that's when they pursued studying that in a larger number of children. So they had almost 2,200 children in that group, and they kind of divided that into almost 1,500 of them got the vaccine with the 10 micrograms, the others got the placebo. So they really studied the vaccine in this number of children, and based on the feedback from FDA, they actually had to increase the sample size as they were studying. So FDA and CDC, they really did a very thorough review. They took their time, they ensured the safety before they authorized the vaccine. To be fully vaccinated, the children need 2 doses, 3 weeks apart, and for the vaccine to do its job, you need another week or 2 for us to mount the immune response. So 2 weeks after finishing the 2 doses, they would be fully vaccinated.
Thank you, Dr. Manapalli. Dr. Taylor, I would want to go back to you for a second. What is our current percent COVID positive rate right now? And what about in children? What has the recent trend been like for positive cases in children?
So over the past 2 weeks in Hall County, we've had 251 cases reported. Those are positive, people who are positive. That's about 122 per 100,000 over that 2-week period, which is much lower than it was at the peak of this recent surge we've had with the Delta vaccine, the Delta variant. The persons who are tested here in Hall County, about 5% have been positive. For children 0 to 4 in the last 14 days, we've had 8 cases, and that's a 60 per 100,000 case rate. So lower, obviously, in that group of children. 5 to 17, which had an enormous peak of cases in the Delta surge, much higher than they've had in our previous waves of this pandemic. Right now, in the past 2 weeks, there have been 130 cases in that population, and that's 345 per 100,000. So cases are going down in all age groups. It's very good to see. Hopefully, we'll get to the low level that we were in the beginning of the summer, and hopefully we'll stay there.
That's good news, and vaccines, of course, will definitely help bring those numbers down. Dr. Taylor, I would like to ask you, what would you tell parents that want to wait to get this vaccine for their children?
Well, obviously, I think parents have a lot of concerns. As you touched on, the vaccine was rapidly developed. It wasn't, again, it wasn't rushed. It was rapidly developed. So I think that the experience of this population is, we're sort of at the beginning of our experience of this population. What I would tell them is that although children have a much lower risk of having severe illness, a much lower risk of being hospitalized, we did see with the Delta surge quite a few hospitalizations, an increase in hospitalizations in children, and a little more severe disease. That said, their risk of that is low. However, children can transmit the illness, and we're coming up to the holiday season. I know that the children will want to see their grandparents, spend time with their loved ones, not be sick over the holidays. And the vaccine is the way that we can control this illness. I think it's important that everyone remembers that this virus only does one thing: it replicates. And when it replicates, it develops mutations, and those mutations are the new variants that we see. It's quite possible, unless we get this under control, that we'll have a variant that does cause more severe illness in children, that is spread rapidly. So I think we can do all we can do together to prevent the transmission of the virus, to protect our older and medically vulnerable population, and to keep the children from getting sick, having to miss school, things such as that.
Yeah,
I really do believe, I'm sorry, I don't mean to interrupt you, but I really do believe that this is a heart-to-heart discussion that a parent should have with their pediatricians, and that the pediatrician, the parent, should come to an agreement about how best to deal with the individual children.
And that's absolutely very important to have this discussion with your pediatrician. And, you know, it's nice to see the numbers going down, but we can't let our guard down completely. So thank you for that. Dr. Manapali, I wanted to talk about herd immunity. What is herd immunity, and why is it particularly important that all patient populations, both high and low risk, receive this vaccination?
Herd immunity is a term we use to indicate that we have enough people in the community who are vaccinated, so that if there is someone who cannot get the vaccine because it's not yet available to them, or they cannot get it due to one of the contraindications, they're still protected. Basically, what we are doing is we are preventing the transmission chain of the virus from one to other. So we are preventing the transmission, we're preventing development of variants. And again, while we don't know what that magic number is, you really want to aim for as high of people as a higher percentage of people in the community vaccinated as possible. And why is it important? As Dr. Taylor said, even though children usually have mild disease, they can spread the infection to others. They can be the carriers to spread the infection to those who are vulnerable. We also heard of outbreaks in educational settings, again, spreading to vulnerable family members. So it's very important that we get our children who are eligible now to get vaccinated as soon as possible vaccinated, so that we can achieve that herd immunity.
And is there any current data or recent studies about the effectiveness of this vaccine, especially for children?
So the study that has just recently been published in the NEJM in the age group 5 to 11 shows that the vaccine is more than 90% effective against COVID-19 infection. So, and also there's been 6 months follow-up data that's been published recently as well for the Pfizer vaccination that included adults and adolescents. And even after the 6 months follow-up, the vaccine remained effective against symptomatic infection up to 90%. But I think what we need to also note is even when the immunity wanes off a little bit over the 6 months, it remained very effective against preventing severe disease and hospitalization.
And we're going to get into a little bit about side effects of this vaccine, but I wanted to ask you, Dr. Manapalli, specifically, is there a difference in side effects in children versus adults with this vaccine?
So one of the things when they did the trials with the different doses in the children, reason they chose the 10 micrograms dose for the 5 to 11-year-olds is because of it being safe, less adverse effects. And the studies indicate that most common, the injection site swelling or some redness occurred more in this age group than the others. But again, these resolve within a few days. The systemic adverse effects like fever was lower with this age group in this population. And they did not notice any cases of the heart inflammation, the pericarditis, or the myocarditis. And there were 4 children that developed rashes. So overall, the vaccine was noted to be very safe.
And then I know we've talked about this before, but I wanted to ask you specifically, what would you say to parents that want to wait on this vaccine?
I think it's very important that we get as many people in the community vaccinated as possible. And I was waiting patiently for this because I was 6-year-old and my teens got vaccinated a few months ago, so he felt left out. And I think even though children usually have mild infection, we have heard of children developing severe disease, even if it is rare. We've heard of children developing the multisystem inflammatory syndrome, requiring hospitalization. And as Dr. Taylor said, the children can transmit the infection to others. So we have to get the children vaccinated to protect everyone around.
Thank you, Dr. Manapalli. Dr. Taylor, what are our community's vaccination numbers looking like currently?
Well, we're still behind the state and the nation as a whole. In Hall County, overall, 49% of residents have received 1 dose, 45% are fully vaccinated. That compares to Georgia, 57% have received 1 dose, and 51% are fully vaccinated. And I believe overall in the United States, we're over 70%. As far as children, 5 to 9, which obviously has just started, 1.4% of those children are vaccinated in Hall County versus 4.4% in the state. For 10 to 14-year-olds, 21% in Hall County are vaccinated, 29% in the state of Georgia. And for 15 to 19-year-olds, it's 46% in Hall County and 49% in Georgia. So we have a little ways to go, and I think that we have a lot of great partners with our health system, with the Longstreet Clinic, and I have confidence that we can increase those rates.
We definitely have some, yeah.
Sorry to interrupt. I wanted to add one thing. Again, based on what Dr. Taylor said about the vaccination rates. Yes, we have great partners. We need to get the vaccination rates up because one of the things as a mom that I've seen over the last 2 years with the children is children being quarantined, staying at home, missing school, or we've heard of schools being closed due to outbreaks. So honestly, it's such a big relief that now we have vaccine available to the school-going children.
Yeah, that's very important. We have some catching up to do. I want to jump to Dr. Herzog. Dr. Herzog, are you recommending the vaccine to your patients age 5 to 11, and how are you walking your parents through this decision?
I'm wholeheartedly recommending this vaccine, and I'm a pediatrician, but I'm also a mom of 2 kids in this age range. Mine are 6 and 8. And I'm also a mom who's on social media, probably more than I'd like to admit. And it's hard to focus on the science rather than the fear mongering. So when I talk to my patients, we discuss risk versus benefit. You know, there's risks of everything that we do in life, whether it's giving Tylenol or ibuprofen or cough medicine, getting into a car, vaccines. And at this point in the pandemic, it's very clear that the risk of the vaccine is much lower than the risk of COVID for this age.
Absolutely. And I've had parents ask me, is it really better to get the vaccine when kids seem to do well with the infection? What have you seen in your practice, especially since Delta, and how do you answer that question?
Yeah, most of the time they do well, and thank goodness. But this Delta variant has been a game changer compared to the Alpha variant before. We've seen far more admissions to both Northeast Georgia and to CHOA with Delta. And then also more concerning is the co-infection with other viruses that we didn't see for a year that we're seeing in the same kids. So we're seeing kids with common colds, but also with COVID, and those kids seem to be more sick than before. We're seeing more older kids that are getting that are having long haul symptoms of fatigue, and then we've seen kids come home on oxygen from the hospital, which just wasn't a thing a year ago. So it's super concerning with the difference with the variants.
Yeah, I want to jump in here myself. Our parents rightfully have questions about the vaccine, and you should feel comfortable discussing these with your pediatrician. I want to take a moment and discuss some of the common things that as a pediatrician I hear in my office. First, like Dr. Herzog mentioned, there's a lot of misinformation about COVID-19 itself and the vaccine on social media. And unfortunately, this misinformation has sort of taken root in the community. We would all urge you to have discussions with your doctors and get actual facts and scientific information. We've touched on this before, but we hear a lot that children don't need this vaccine, but children are affected by COVID-19. We've seen this in our offices. Thankfully, most of them are mild symptoms, but I've had patients hospitalized. I have patients that I take care of that are suffering from long haul COVID symptoms. We've seen patients with the MISC, which is a serious inflammatory condition that's been linked to COVID. So it's very, very important that we are discussing how important the vaccine is, and for you to get information from your pediatrician. If your child has a specific health condition, severe allergies, those are discussions that should be had with your doctor. And finally, I want to say that even kids that have already had COVID-19, that had the infection, we still strongly recommend the vaccine for these children. The vaccine creates a stronger immune response so that kids can fight off future COVID-19 infections. So even if they have had the virus, we still recommend getting the vaccine. I want to jump to Dr. Farley now. Dr. Farley, what kind of side effects could a child experience with this vaccine?
Really what everyone else has already brought up. I think the most common said 70% of kids had pain at the injection site, and that's not a surprise. I mean, adults, we all have pain when we get a shot. And so it's not a surprise that the children would have that. Fatigue and headache were the next most common. And the other ones, chills, fever, vomiting, all of those were reported in less than 10% basically of kids. And so really not a whole lot of problems with side effects so far.
Yeah, and I think with this age group, like Dr. Monopoli mentioned, there was no risk of the myocarditis, which myocarditis is a very rare side effect that was seen in older teenagers. And we did not see that in the trials, at least with this age group. So that's definitely good news. Dr. Farley, can you tell us what you recommend, tips and tricks for helping manage side effects of some vaccines?
Sure. So I think the biggest thing is just being aware. So just like for our own selves, if you have a kid that you kind of think, especially if they're a little on the dramatic side, consider getting the vaccine on a Thursday, Friday, Saturday. So if they aren't feeling 100%, they're not missing school. Certainly, especially in the teen population, we get passer outers. My own child was one of those. And so if you know your child's going to get lightheaded and try to pass out, tell the person giving the injection, hey, my kid's a passer outer. And that way they can have them seated, have them lay down afterwards for a few minutes. Tylenol, Motrin fluids, all of that kind of stuff with any vaccine, just to make yourself feel better. And truly, I think in some ways, one of the biggest things is, I guess, distraction. I don't mean from the actual, getting poked part, but kids pay attention to the people they trust, their parents, their doctors, their teachers. And so, if a parent is hovering over going, oh my gosh, do you hurt? How does that feel? The kids can be like, oh my gosh, I'm dying. Whereas if you're like, yeah, I think you're okay, so just kind of distract. I mean, certainly if they come to you and they're having a side effect, help them out, give them some Tylenol, whatever you need to do, but don't go sort of pushing them to see if they're having any of those kinds of symptoms.
And when should they reach out to their pediatrician because of side effects or symptoms?
Really, it really depends on the parent and the child. So we are here, those of you who see us, that you know us, we care. And even if it's just reassurance, I don't care, call me for reassurance. I'm happy to talk anytime. And the big red flag, I think the biggest thing would be chest pain, that kind of thing, worrying about myocarditis, which fortunately does not seem to happen. But, as Dr. Herzog pointed out, it's all risk versus benefit. And, there's no one of us who can say, oh, that is impossible that it would happen with this. The other thing, of course, is through the CDC, the V-Safe is a great place to be able to put in, vaccine reactions and have them helping you as well. So.
And with that myocarditis, I just want to point out that the COVID-19 infection itself is a bigger risk for the heart and for myocarditis than the vaccine is. So that's also important to point out. I want to go to Dr. Herzog now. Dr. Herzog, there have been concerns about long-term effects of this vaccine, and I've heard this in my office lots of times. There are rumors about infertility. We've touched on heart issues. Can you talk about long-term side effects of this vaccine and if there's any scientific evidence for this claim?
We don't expect any long-term effects. And although we haven't given this vaccine to kids for very long, we have given millions of doses to adults over the past year. And so we have great data, both in the United States and across the world, of adverse events. Traditionally in vaccines, you see an adverse event, a serious adverse event pop up within the first 6 weeks after injection. And we just haven't seen anything, besides what's already been mentioned. And we have decades of experience with other vaccines, and we just don't see adverse outcomes that pop up 10, 20, 30 years later. As far as the infertility, it just doesn't make sense for the shot to cause that problem. Now, COVID disease, however, can cause some issues with that. And we talked about myocarditis. Sure, it's caused myocarditis in some kids, some older kids with the shot, but like you just said, Dr. Hussein, we see far more issues with myocarditis with the actual disease. And so to sum it up, we don't expect to be any long-term side effects of the vaccine, but we do expect there to be long-term side effects of COVID disease.
Yeah, absolutely.
I just wanted to add to what Dr. Herzog already said. In the study of the 5 to 11 age group, they actually monitored the kids, or this data published, they followed the kids for 2.3 months. They'll continue to follow them for 2 years. But that's another thing that FDA wanted to see. They wanted to at least see data for that duration before they are going to review and authorize the vaccine. And as Dr. Herzog said, long-term, most adverse events are seen within that first few weeks after the vaccination.
Yeah, absolutely. Dr. Herzog, have there been any new trends in side effects from the COVID-19 vaccines at this time that have been identified for further study, either in children, adolescents, or adults?
None. But again, they're monitoring that with V-Safe and with the VAERS program.
Yeah. And then I want to ask you, Dr. Herzog, what would you say to parents that want to wait to get this vaccine for their kids?
Dr. Manapali said she was patiently waiting for her 6-year-old. I was very impatiently waiting to get my kids vaccinated. And as soon as the CDC gave the go ahead, my kids, had it in their arm within 24 hours. We've talked about the medical effects of COVID, which are scary. And yes, it's low risk, but I'm just not willing to have my kids be the ones that have the problem. But the non-medical things, the emotional, my kids need to be in school. My kids need to play sports. They need to be around their friends and family. And especially this close to the holidays, they can be fully vaccinated before their grandparents come around, which was super important, for everybody's mental health.
That's great to hear. One important note while we are talking about vaccines, and I want to jump to Dr. Farley. Dr. Farley, can the COVID vaccine be given with other vaccines, like the flu vaccine or the regularly scheduled immunizations that children receive?
Yes, so there's really no limits at this point. Initially, there was doing it 2 weeks before or after, and I don't think anybody was especially worried about an interaction, but it was more just to be able to accurately monitor for side effects and so forth. But at this point, absolutely give the flu vaccine at the same time, or do it when you come in for regular vaccines. Yes.
And I want to ask you the same question I've asked the rest of the panel. What are you telling your parents that want to wait?
Basically what you all have said. I mean, it's very hard because obviously we are experts in children and we are experts in infectious disease, but I'm a big proponent of parents being experts in their own child. And so we do have to respect, I think, that it is parents' choice what they do. I think our job is to, just like this forum and one-on-one, and I highly encourage parents come and talk to your provider because we care about your kids. And so as Dr. Herzog said, hers were done within 24 hours. My children are older, they're teenagers, and they also were immunized as soon as they could be for this, because long-term, the worries I have about long-term effects from the disease way outweigh any concerns I have about the vaccine at all. But it is a very individual thing. So again, if you have concerns, then you need to talk to somebody you can trust.
Absolutely, we're available to answer those questions and concerns and give you information so that you can make an informed decision. I do want to ask Dr. Manapali another question about the approval process. Dr. Manapali, do you know when it will be approved for children less than 5? Where is it in the process for that age group?
I think I do not have any specific timeline, and I don't want to speculate. I don't know if Dr. Taylor or the others want to add. Again, I think they're really taking their time to monitor the safety, the dosing, all of that before they even review the data, and probably are going to look at it like they did for the 5 to 11-year-olds, at least for the 2 to 3 months worth of data before they review. Dr. Taylor, you have anything to add?
I don't have anything to add to that. I don't have the timeline either for that. I know that it's under study, and it'll probably take a little more time because it's, they have to recruit the children for the trials, and again, they're going to have to determine what the appropriate dose is for that age group also, because you have a wide variance in weights and growth at that time. Determine what age is the appropriate age to give the vaccine to children. Most vaccines we don't give to children at birth. We wait until they're a little bit older. So there's a lot that goes into determining about that particular age.
And also, I think we'll hear about the 2, 3, and 4-year-olds before we hear about the authorization for the 6 months to 2 years, because they have categorized them into these 2 separate groups as they're studying the vaccinations.
And I know that we as pediatricians appreciate the thoroughness of the process and all the time that they're taking to make sure that we get this right. We've been talking about the COVID vaccine, but this is a good time to remind everyone that if you delayed any of your child's vaccines last year because of the pandemic, this is a great time to call your pediatrician's office and get them back in Remember, many of these vaccines do take a series of shots for completion. So it's important to start that process, especially for kids that are in school and those that are going to be heading off to college. Dr. Farley, I want to go back to you for a second. We just came off, of course, this recent Delta surge that impacted our children differently from the first strain of this virus. Have you heard of any additional variants of concern, particularly for children?
So I have not heard of a specific strain. I know that there's several out there that they look at, and I defer to Dr. Manapali and so forth who know more about this than I do. But I think the take home message for parents is that these viruses, I mean, it's basically, it's their job to evolve and change and survive. And so they're trying to mutate, or they're, I don't know, trying, but anyways, so we have to expect that and we have to anticipate that. And so unfortunately, I think that we will continue to see this. I did want to put in, I don't think anybody's mentioned, one of the big questions about dosing is, what if I have a, 120-pound 11-year-old? What if I have a 60-pound 12-year-old, in terms of that transition on the dosing? And I just want to point out there that it's not weight-based. It is based on the maturity of your immune system. And so that's where you start to see that difference. It's not a weight-based issue.
And I have another question about dosing, and I'll address this to Dr. Manapali. Dr. Manapali, if you have a child that's 11, about to turn 12, and they get their first dose, what's recommended for their second dose? The lower dose or the higher dose? Can you give us some insight?
12, yeah, if they turn 12, they get the higher dose.
Okay.
So you go by the age, yes.
Okay. I want to touch on masks for a little bit. Dr. Herzog, I'm going to address this to you. At this point, when should people wear masks? When should they not? Can you provide us some guidance on that?
Yeah, so masking after vaccination, it depends on the rate of infection in your particular area. And so Hall County is still considered to be a high risk of transmission area. So technically the CDC recommends masking indoors when you're not around your family. My kids are still wearing their masks in school, some for COVID prevention, but mostly because of the incredible rate of the normal winter viruses we've been seeing. We've been seeing them earlier than usual. And like I said before, I want them in school as much as possible. So my plan is, even after they've gotten their 2 doses of the vaccine, that I'm just not going to tell them to stop and see how long I can kind of ride that wave and enjoy less germs.
Yeah, we did see a significant decrease in other viruses as well because of all the mitigating strategies, the mask, the hand washing, the social distancing. So we know those things work. Dr. Manapali, things are changing as more and more people are vaccinated. What are the current rules for quarantining for vaccinated and unvaccinated individuals? And specifically, I want to ask about what you think the schools would be doing with kids that are vaccinated when it comes to quarantine and isolation.
So if someone has had an exposure, if a child has had an exposure to the COVID-19 virus, if they're fully vaccinated, they do not need to quarantine, which means they do not need to stay home or miss school. When they're indoors, they need to wear a mask. We watch their symptoms. If they develop any symptoms, they need to get tested. But even if they do not develop the symptoms around that day to 5 to 7 days, it's recommended to get them tested. So I think the big thing is they don't need to miss the school. So, but if they are not vaccinated, the guidelines for the unvaccinated for quarantine pretty much remain the same. They have to stay home for 14 days, unless if it's they have to get tested around that day to 5 to 7 days again. And again, in some circumstances, if they don't develop any symptoms, then they can end their quarantine at day 10, but still need to monitor for symptoms and wear mask when around others. So I think that's the big thing when it comes to those who are fully vaccinated, that they don't need to stay home, miss their work or miss school.
I think, as Dr. Herzog mentioned, we definitely want our kids in school, and getting vaccinated is a good way to ensure that.
Mm-hmm.
I want to talk about now vaccine availability in our community. So we want to share some resources. At Longstreet Clinic, we have set pediatric COVID vaccine clinic days, and we have certain times that we are giving these vaccines out at our Gainesville office. This will continue as long as there is demand. We are also setting up specific days in our Beaufort, Oakwood, and Brazelton clinics. In fact, as we are talking, Brazelton is giving out vaccines for COVID for this age group today. And we're scheduling appointments and taking walk-ins on those clinic days. Our patients can call our vaccine line. That number is 678-207-4402. And we will be putting up links in the comments. There's also information on our website on being able to schedule the vaccine. Dr. Manapali, can you share availability for this vaccine at NGHS and NGPG?
Yes, one of the things we have done is working with our pharmacy colleagues to make sure the vaccine is available through the EDs if there is a child who's presenting there and is eligible, and also for the inpatients prior to discharge, again, if they are eligible. And of course, through all our Northeast Georgia Physicians Group, family medicine and pediatric offices as well, the vaccinations are available for the 5 to 11 year age group.
And Dr. Taylor, what about at the health department? Do you have clinics set up? And do you know of any pharmacies or other groups that are planning to provide these pediatric doses?
So at the health department, which is open daily from 8 to 5 p.m., we do have late hours on Tuesdays until 7 p.m. and then we close at noon on Fridays. But we offer the vaccine at any time. If a parent can bring their child by, they can just walk in. They don't need an appointment. We'll be glad to vaccinate the child. We do ask that obviously that the parent needs to sign the consent form, or the guardian does. And we do ask that they be accompanied by a parent guardian as they come in to the health department for the vaccination. They can call the health department at 770-531-5600. But as I said, they don't need an appointment. They can just walk in. I do know that there are some pharmacies in grocery store pharmacies that are offering the vaccine for children. But I'd suggest that the parents call ahead prior to going there to see if they have it and if they're offering. This is a different formulation of the vaccine. It's not as if they just draw up less from the vaccine vials that we use for adults. It's actually a different vial. It's constituted differently than the adult vaccine. So they may not have it there, and they should check before they go.
And of course, your pediatrician's office, so definitely call and talk to them as pediatricians. We do vaccines all day, every day, so definitely reach out. As we wrap up today, is there anything left that we have not addressed that anyone on the panel would like to touch on? Okay. I want to thank everyone for joining us. COVID-19 has provided a reminder of how essential regular vaccines and immunizations can be to the health of individuals, as well as our entire community, adults and children alike. We have devoted this conversation to the COVID vaccine, but we are also starting to see flu, so I urge you to get the flu vaccine as well. We understand that this information can be overwhelming for any parents to navigate. We all want to look out for the well-being of our children. And as you are deciding what is best for your child, we encourage you to talk to your doctor or pediatrician about your concerns. Like we have mentioned, there's risk in almost everything that we do, but the risks associated with contracting and spreading COVID-19 far outweigh any risks that we see in vaccinations. Thank you so much, Dr. Farley, Dr. Herzog, Dr. Manapali, and Dr. Taylor for joining me today to answer these questions. We appreciate everything that you have done and continue to do to keep our kids and the community safe. And thank you all in the audience for joining us today and taking time out of your busy days to listen in. We know the parents have an important decision to make, and we hope that we were able to help you in that process. Please share this post if you found this information useful. And thanks again for tuning in, and please get vaccinated.
Thank you, Dr.
Thank you.
Thank you.